Suicide is the principal cause of death among people aged 15 to 19 years. According to the World Health Organization estimates yearly, suicide cases are close to 1 million. Chief Executive of the Mental Health Authority, Dr. Kwesi Osei, said about 5 people commit suicide daily in Ghana. He said attempted suicide is a sign of depression and a cry for help. He called on the public to take advantage of the Suicide Help Center. According to Dr. Osei, a petition has been presented to Parliament and the Attorney General to decriminalize suicide.
Suicide prevention, and this follows closely after the heels of World Suicide Prevention Day on 10th September 2019. It was on the same theme, preventing suicides. The focus on suicide and its prevention by the mental health fraternity worldwide speaks volumes for mental health as a public health crisis that is manifesting through suicide. What makes the phenomenon of suicide more crucial is the fact that victims of suicide these days are mostly the youth and even more worrying, children. In the past, if you heard of anybody committing suicide or having attempted or tried suicide, that was probably an elderly person, at least somebody in the 50s, 60s, and mostly men. These days we are seeing a reversal of the data. Much younger people and even more women than men. It is often believed that it is only adults who exhibit suicidal behaviors, but it should be made known that many children and young people engage in this phenomenon as a result of violence, sexual abuse, bullying, and cyberbullying, among other factors. Suicidal behavior has existed throughout human history, but due to several complex factors, it has increased gradually in all parts of the world, and in the past few decades, it's been climaxing and it's received alarming statistical levels. The WHO puts the figure of people who die by suicide a year at more than 800,000, making it the principal cause of death among people 15 to 29 years old. For a breakdown, every 40 seconds, the world loses somebody through suicide. So in the about 80 seconds or so that I've been talking, at least 2 people have died. And in the next 40 seconds, 1 person is going to die, unfortunately. Ladies and gentlemen, we have now come to a stage in our national development and with respect to the subject matter under consideration, suicide, that we need to decriminalize suicidal behavior. People have wondered, or they have thought that if you decriminalize attempted suicide, it means you are encouraging people to commit suicide. Far from that. Our Criminal and Offences Act says that attempted suicide is a misdemeanor. Yet, as we have said, attempted suicide is oftentimes a sign of depression or another type of mental illness and a cry for help. Anybody who attempts suicide is basically saying, society, please, I need help. Come to my rescue. And instead of rescuing the person, we say, go to jail. We have sent a petition, as we speak right now, to the Parliament and the Attorney General. We have sent reminders, and we hereby reiterate the need to decriminalize suicidal attempt.
Director at the Accra Psychiatric Hospital, Dr. Fina Apau, wants the public to pay attention to persons who hint of plans to commit suicide.
We're saying that before someone commits suicide, a person may communicate it in some way or the other, all right? And so we are advocating that people sit up and take notice of people around them, those around them. You must listen to what they are saying, because if the person is communicating, the person may communicate it in his or her behavior, what the person may be doing. For instance, a person may start giving away his or her properties, a person may start writing a will or so on, and the person may actually talk about taking his or her own life. When we see some of these things, it's important that we give, we don't dismiss them, but we actually find help for the people, the person. We are also saying that you don't need to come to the psychiatric hospitals to access help. You can go to any health facility at all and you can access help. And again,
the Health Authority expects to organize series of activities to raise awareness throughout the year. Agape Kwenus reports for Joy News.